I'm South Shore Press News Director Stefan Mihailu, joined by Dr. Howard Adler. He's the Medical Director of the Prostate Care Program and Clinical Associate Professor of Urology at Stony Brook Medicine. Doctor, thank you for joining us under difficult circumstances. Thank you.
You're welcome. My pleasure to help.
So President Biden released this statement about his prostate cancer diagnosis. Quote, on Friday, President Biden was diagnosed with prostate cancer characterized by a Gleason score of 9 or grade group 5 with metastasis to the bone. So doctor, how serious is this cancer?
Metastatic prostate cancer is unfortunately incurable. There are treatments that the president will be able to receive. Metastatic prostate cancer, just there is no cure for it at this time. Being a Gleason 9, that makes it a more aggressive cancer. Grade group 5 is the highest possible grade.
Doctor, you mentioned treatments. What are those? Since this is an incurable cancer, is it more along the lines of trying to make him as comfortable as possible?
We don't know anything about what symptoms he's having. Right now, it's about maintaining quality of life as well as extending his survival, extending his lifespan as long as possible, while mitigating the potential impacts of an advanced cancer. And that would include need for other therapies, developing bone pain, assuming he's not symptomatic right now with bone pain, as well as preventing progression of the cancer.
And so, when it comes to a life expectancy for anyone under these circumstances, are we talking weeks, months, years? What would it be, generically speaking, of course?
Well, with the current available therapies, he can expect to have, on the average, of about, I'd say, 4 to 5 years of survival. However, it's not as if that we can put a clock on it, because they're assuming that the current therapies that he might receive, if they eventually fail, there are other therapies that can be used. So it's going to be, sort of what happens on a wait and see. How does he respond to initial therapy? And then, do any of these therapies fail? Does he need other therapy down the road?
And last question, doctor. Prostate cancer runs in my family. My late father had it. I get tested on a regular basis because of that. What would you say to men about the importance of getting screened for this on a regular basis?
Screening is very important. A number of different societies, specifically in this case, the American Cancer Society and the American Urological Association, do have specific guideline recommendations for men when to start. Typically, men should start screening at age 50 unless they are in a higher risk group. And so that would include African American men as well as men who have a strong family history, first degree relatives, and advanced cancer as well as cancer at a younger age. I will say what becomes somewhat controversial is the testing of men who are older, particularly men who are in their upper 70s and 80s for prostate cancer, because most of the time prostate cancer in those men tends to be not impactful, and men are more likely to die with prostate cancer rather than from it. So I will say that it's a situation that we do see, but it's not necessarily what we expect, because most men who are in their 80s, physicians are not performing PSA testing, prostate cancer screening these men. In fact, actually, the discussion is usually to not do it. I myself individualize this, and I do have a number of older men where we are watching their PSAs and then acting accordingly based on whether or not it's stable or if it's going up quickly. Interestingly, at least with the limited information that's out there, the only thing that I've been able to see is that this was diagnosed because of a nodule on physical examination. That is not how most prostate cancers are diagnosed in the majority of men. Typically, it's on the basis, as you know, on a elevated or rising PSA, prostate-specific antigen level. I've seen a lot of things on the internet, that they should have known about this. We don't know what testing he's had over the last 4 or 5 years, or even before that. We don't know what those results were. So I think the conjecture is just unfair, and people should just have good thoughts and prayers for the former president.